Welcome to the Pro Aging Podcast. My name is Steve Gurney. I'm with Positive Aging Sourcebook, and we have a fantastic conversation today with Larry Nisenson, who's Senior Vice President for Genworth U.S. Life Insurance. And regardless of why you tuned into this, because of the title or Larry, Larry just reveals a wide variety of resources to older adults, to the senior living segment. Genworth has made a great commitment to this segment, and it was a hard podcast to title, but looking forward to sharing this discussion with you. So let's jump into it right now.
Larry, thanks for hanging out for a little bit, and I'm really excited to get this conversation started. Before we jump into some of the data and information you're going to share with us, tell us a little bit about yourself, your background, and what organization you're with, and what do you do?
Absolutely. And thanks for having me, Steve. And by the way, before I start that, I have to tell you, what a powerful group you've got sponsoring. I mean, to see a bunch of energetic women leaders in their communities supporting this is fantastic. And thank you for having me and letting me join them. I am one of those people who is incredibly fortunate to have both their passion and enthusiasm aligned to their career. There's not a lot of people who get to say that, but I am fortunately one of them. And I say that because I have been a caregiver for the last 15 years. I am a family caregiver, like I imagine many, many are. As a matter of fact, we know the statistic. There's over 40 million unpaid family caregivers. And I'm just one of the many, and we're going to talk about that. But my day job is I get to lead the Genworth U.S. Life, which is a long-term care life and annuity company. I get to lead our commercial efforts. So I have the pleasure of working with about 150 people or so, and we do all of the sales, marketing, media work around our long-term care insurance products and our caregiver advocacy programs that we have. And we have two of them in market. And so, again, there's not a lot of people who get to talk about their passion for what they do personally and align that professionally. And I'm one of those lucky ones.
Yeah. And I tell you, like, I've always been impressed with Genworth because I referenced that cost of care survey that you guys, how many years have you all been doing that?
17 years in a row that we've done it. And we actually do two. We do the cost of care, which if your viewers haven't had a chance to look at it, it's purely educational. There's no sales involved. There's no pitch involved. This isn't a sort of way to get you underneath the tent and then we pull you in. This, all it does is look at the cost of providing care for those that need it in both nursing homes, assisted living, and in-home care. And it looks at all 50 states, and it looks at the geographic or the regions inside of it. So you go to the site, it's genworth.com, right? You put in your zip code and it pulls up private care for those three, public care, semi-private, and it just is purely educational.
I just posted it in chat for everybody. And just to tell, everyone, I reference this on a regular basis. It is amazing, and hats off to Genworth. Like when Larry kind of came on my radar as somebody that I might be able to get on, I didn't hesitate at all because I've been so impressed with some of the research and data that Genworth doesn't have any kind of sales angle to it whatsoever. It's almost sort of like, okay, guys, why don't you try to sign me up for a policy? But I think I'm always impressed by companies that take that approach, because actually that approach of just giving objective, unbiased information is probably the most effective way that we can sell and market to individuals and organizations.
There's no question. Look, we're a for-profit company. So to say that we're purely doing this, from an educational standpoint would be a silly thing to even put out there. But we do believe that education and awareness are the key to understanding your choices. It's funny, I was just asked to write an article on the difference between what Medicare covers and what it doesn't cover as it relates to long-term care. It's one of the great misunderstandings in terms of what's covered, right? And we know that 7 out of 10 people are going to have a long-term care event in their lifetime and need some sort of help. Yet less than 10% own a way of financing that, which means most people are going to rely on either their family and their loved ones, or they're going to have to deplete whatever resources they have and then rely on the state. So we want to make sure that people understand what their options are, understand what's in front of them. And so we do this survey, the cost of care. We do a different one called Beyond Dollars. And the Beyond Dollars is really aimed for those that are employees and employees of a company and family caregivers. They know the incredible struggle, right, of working for a company and having to take time off and trying to squeeze in these conflicting responsibilities. The Beyond Dollars survey is aimed at employers to say, here's what the cost of lost productivity is for you. You should think about putting in a caregiver support program. And there's many of them out there. And we try and elevate that level, again, of education and awareness so that employers, especially in these days, right, can step up and help their employees solve this unbelievable burden and responsibility that many do willingly, but still have to figure out how to balance.
Yeah, no, and I'm glad you brought up this sort of the employee caregiver and the caregiver. That's again how you crossed my path, because you guys did some research on family and employee caregivers. But as we were talking before this event started, why don't you just share some of the cool research and information that you guys have, because you were telling me about a different survey related to COVID-19 yes. that you recently did. So what I would say, folks, is that just a reminder, you can ask questions or comments at any point during this conversation. And Larry's a great resource, and we can just center some of these topics and have an open discussion. But tell the audience a little bit about that COVID survey that you guys just did.
Absolutely. One of the investments that Genworth made years ago was to build out our own proprietary research arm. We did it because we believed in this education and awareness. And so the question became when like most companies, right, on March 1st, we sent 4,000 employees home, as most companies did. Well, it's interesting, Genworth is a mission-driven company. And we probably have more caregivers at our company than most do because of they're sort of aligned to their interests. And we realized that there was an opportunity for us to really look at what impact COVID-19 has had on family caregivers. And so in early May, we underwent a study really of the first 60 days, really all of March and all of April. What impact did COVID-19 have on consumers in general? Yes, caregivers, but more importantly, we wanted to understand how many emergent caregivers there were today, right? In the normal world, we know there's somewhere between 38 and 42 million unpaid caregivers in the United States. And we know that number is going to crest up over the next 7 to 10 years to somewhere around 48 to 50 million unpaid caregivers. So if you think that there are 350 million Americans living in the country, you start to get a sense of really what the size of that is. You're talking about 12, 13, 14% of the population. We wanted to understand what COVID-19 did to that number. And so we underwent this survey, which your viewers and listeners can find it on the genworth.com website. There's a banner that runs across that says, click here for COVID updates. And when they click on that, you'll see that there's the consumer sentiment study around COVID-19. And here's what we found out. That 1 out of 3 people that we polled were emergent caregivers. So where the number was 40 million, let's call it squiggly line 40 million, that number now ballooned to over 100 million emergent caregivers. That's people who are like me, caregivers normally. That's people who now were faced with their children coming home and being sent home from school. So now they've got to be teachers in addition. I live in New Jersey, and New Jersey had the highest incidence between New Jersey and New York, not where you'd want to be a leader, but we happen to be a leader in the percentage of deaths from COVID-19 in nursing homes. So we've seen an exodus of people pulling their healthy loved ones out of nursing homes and moving them back into their house or into their house initially. All of this added up to well over 100 million caregivers. That is an incredible statistic. And more importantly than the statistic is what it did to people. 40% of them, 48% of them actually, said that they were unbelievably stressed. They were aware of their own sort of vulnerabilities now, which they never had to worry about. Over 58% of them said, look, we don't know how we're going to handle the stress, but it is an incredible burden to us. Those are just some of the statistics that jumped out, and there's a whole host of other ones that came from it also.
Yeah, no, I mean, it really, people, and, from an employer perspective, now your employees are working from home. They've got the kids. Mom's moved out of the nursing home to live with you. I mean, we've seen people making decisions that they think are the best decision that ultimately in COVID, because there's no script here, is creating more chaos in the workplace, in their personal lives, and for their parents' healthcare.
There's no question that, look, for those that are caregivers that have gotten used to the routine, right? It's hard to potentially remember back to what I describe as that fateful Tuesday afternoon call, where your life is going along. Everything is fine until you get that call from a loved one, from a doctor, from a hospital, whomever, that says something has occurred to a loved one or a family member, and your path in life has just changed, right? You are now the primary caregiver for somebody, either temporarily or as a long-term. And the longer you go through this, it's hard to sort of remember what it was like when you got that call. But imagine if you're in the middle of this COVID fiasco and you get that unbelievable call that says your loved one, whomever it is, isn't taking care. You have all of these emotions flooding through. You're not an expert in making any of these decisions. The stress level is through the roof. And I listened to some of the research that we had done in some of the interviews, and it's palpable. You can hear the angst, the concern. People don't want to make wrong decisions. Forget terrible decisions. They don't want to make any wrong decisions at all.
Yeah. And, most of the folks in our audience are providers, and we've all been going through this individually on a micro level. But guys, one of the things that I've often found that's helpful for me, and it's helpful for people that I talk to, is it's sort of like, look, you're not alone. And, sharing the Genworth research and what have you, to let people know that, yes, it's natural to be stressed out. This is a difficult decision. And then helping them with resources. I knew since we led in with the cost of care survey that a few questions might come in on there. Louis Tenenbaum asks or comments, can we help the cost of care survey fill out the info regarding the cost of home care? What is the impact of home modifications and updates on the time one can stay in their home and caregiving? One study says that a modified home reduces the time needed for caregiving by 42%. Yeah, Louis is a pioneer in the universal design remodeling area, and I agree with him in that, a lot of times when we're looking at the I hope I didn't lose Larry there.
Nope, I'm here. I don't know what happened.
Okay, good.
There we go. Yep.
Yeah, I mean maybe connecting with Lewis in terms of the adding home modifications, making that more of a kind of, yes, I want to age in place. Let me equip my home so that it's safe and I can live there for a longer period of time.
Yeah, I think that's a great point. And Lewis, our research is 100% aligned with that. We know, first of all, people want to forget COVID for just a second. People want to age in place. Nobody wakes up in the morning and says, I can't wait to get into a facility. They may end up in a facility, but people, especially as they're aging, want to do it in place. And we know that keeping people at home in place keeps them healthier longer. The family caregiver, having that family caregiver provide assistance, keeps their mental acuity, keeps that care recipient in much better shape. And we do try to incorporate some of that, but I'm happy to connect with you and talk a little bit about what your experience has been and how it might help us inform on some better at-home pricing if that's what's needed.
Yeah, and wow, guys, I added the COVID caregiver link to the chat, and I was just glancing at it. Some really good data there in terms of like how when somebody is a caregiver, how much extra time they are spending per week on this caregiving task. And when our employees were all going to offices, they were still doing that. Okay. I mean, that extra 9 hours or what have you.
Yes.
But now it's right behind them, and it's opening the door in the middle of one of their Zoom calls, you know.
There is no question about it. It's funny. I probably have spent more time over the last 30 to 60 days working with companies, with HR, with chief HR officers around how they want to recraft some of their benefits. And lots of questions I get from companies are, what can we do to help? How do we help the caregivers? And the first thing I point to them is, look, you know, Steve, to your point about those 9 extra hours, they don't magically appear, right? If you're putting 9 hours in, you're getting those 9 hours somewhere. Either you're taking them and stealing them from the workday, you're doing stuff before or after, you're doing it on the weekends. It doesn't happen magically. And by the way, that 9 hours is really a little bit off because it doesn't talk to emergent caregivers. Emergent new caregivers spend much more time as they're getting comfortable. They don't know what to do, right? And so it is unbelievable pressure, and we've got to solve it. And Genworth is happy to play a role in it, and as you guys are as well, of course.
Yeah, no. So, what are some of the other things that are going on? Tell me a little bit about. I haven't dug into it, but you've got something called CareScout, I think, or what is that?
So we about 10 years ago, we bought a company called CareScout. They're based in Waltham, Massachusetts, and they are a care advocacy company. They're in business over 20 years. We bought them because, as the leading writer of long-term care policies, we, when somebody wants to go on claim, right, we send a team out to do an assessment to make sure that they're ready to go on claim. And CareScout started as an assessment and advocacy company. And so we bought them about 10 years ago. And they are really care advocates. They are a network of 100,000 care professionals. And in that network are nurses and social workers and licensed clinicians and people who do, like Lewis, home modifications, and every business, much like the group that's sponsoring you, it's sort of represented everybody in the industry, right? And CareScout is the leading provider of care advocacy in the country. Last year alone, we worked with 55,000 families that were caregivers to provide advocacy work. And so some of that advocacy work is sending out a nurse or a licensed clinician to go do a home visit and help them figure out, is my loved one in need of more care? Do they need home modifications? Then we go back and we start to do sourcing work for them. So let's say they need 24-hour care. An emergent caregiver doesn't know even how to go find care, much less what questions to ask, right? Our team at CareScout is the intermediary that steps in and does all of the sourcing. They find the caregivers that are available. They do all of the negotiating. They find availability. They string together all of the workers needed to fulfill whatever that family caregiver needs and support, and then creates a customized plan of care for that person and their loved one, and acts as an ongoing intermediary on behalf, almost like an ombudsman, if you will, for that caregiver and their loved one in sourcing all of the care help that they need.
Wow. Now, I'm surprised that this didn't pop up yet, but I know everybody's sort of like, okay, well, how do I get on the CareScout list of companies if I'm out there as a provider? And I guess the other question is, how does CareScout align with like aging life care managers and other professions that are sort of out there giving guidance to families and individuals?
So let me tackle the first question, then we'll get to the second question. The first one is easy. By the way, and this is a huge selling point for us when we talk to employers, we offer this service to employers, right, for their employees, and say, this will alleviate the work and the stress and the lost productivity that I talked in that Beyond Dollars survey we do. But we take no money. We take no referral fees. We don't take any revenue split from providers. You can't buy yourself onto the list. And employers and caregivers love that, right? Nobody wants to think they're being referred to a company because somebody's paid to be on the list. Don't work that way. So if some of your providers want to be on the list, again, it's carescout.com is the web address for the company.
Yep,
you can go there and there.
Yeah.
Oh, perfect. And so if you go there, there's a provider page that asks for some information, and they can certainly reach out to me, and I'm happy to connect anybody with our CareScout team and let them do the vetting process. As I said, we've got 100,000 professionals inside of this, 35,000 nurses and about 65,000 other professionals and facilities. And we're always looking for more because our goal is to blanket every geography inside of the 50 states. And we work with clients. As a matter of fact, 2019, I referenced that 55,000 cases that we worked. Every state was represented. So even Alaska, even Hawaii, Puerto Rico, the territories, as long as it's considered to be the U.S., we want to be able to help and cover people. So the more providers we have, obviously, the better it is.
So that's great. So what I'm hearing is, and I know that so many of our providers are always looking at this. Somebody has a long-term care insurance policy. You guys still have long-term care, Genworth?
We do.
Yeah.
We do.
So you got a Genworth long-term care. Actually, there's a few comments that some of the providers are work with Genworth with their clients, but so somebody, it's sort of like a health insurance company. It's sort of like, oh wow, mom needs care. She's got this policy. The first place that somebody might call is that insurance company, and that's why you acquired CareScout.
Absolutely correct.
Okay, good. So guys, this is a great resource. It's a great like arrow in your quiver. And my second question, the follow-up on that is that sometimes, like, that there might be some professions out there that are like, wait a minute, I do assessments and I give guidance to clients. Like, how do you work with, aging life care managers and other providers that are boots on the street doing those types of assessments?
So we do work with them, but again, because we are really aimed at a care recipient, right? We work with the family caregivers. Now, if they have a private case manager who they're working with, we are happy to accommodate them. And there are several that I've personally worked with through CareScout and through one of our policyholders who may have an advocate working with them or a private case manager who knows the local geography or they feel more comfortable using. And we certainly work with them directly and through the family. What we generally haven't done, because of the way CareScout has been built, is we don't refer to case managers and private case managers, because the relationship between us and the policyholder or the caregiver is a direct one. We don't necessarily want to put an intermediary in, but if there is one because the family prefers that, we're always happy to work with them.
Okay, cool. No, great. So great resource for you guys. Just work to get on the list. Maybe you can, go through their process. It can't hurt. And it's a good resource to let individuals know, because you don't have to be a Genworth policyholder, correct, to use CareScout?
That's correct. But and just to sort of put some size around it, we are the leading Genworth. Long before I came to the company, Genworth was the originator of long-term care policies. We've been writing them for over 40 years, and we have about 1.3 million long-term care policies. As a matter of fact, we have more policies on the books than probably number 2, 3, and 4, and maybe even 5 combined. So we are the 800-pound gorilla in long-term care policies. And all of those policyholders, or certainly a vast majority, will need care. I mean, that's just statistically the way it's going to work, right? And our goal is to keep them living healthier, longer, right? Again, we're a for-profit business, so to the extent we can keep people healthy living, that's good for us. It's certainly good for them. Our interests are aligned. And we need to have partners and providers spread across the country. So if one of your providers or your viewers or listeners want to participate, we'd love an opportunity to talk, especially if they happen to be in a place where we have a gap, right? And we need to fill it. So absolutely.
Awesome. No, this is great. I noticed that Peter Liu has his hand raised. Sometimes this is by mistake, but whoops, let's see. Whoops. Oh, yeah, he just lowered his hand. Barbara Sullivan. Okay, Barbara Sullivan's got her hand raised. Barbara? Whoops. Okay, sorry about that. But okay, well, this is awesome. This is an awesome resource that I didn't actually expect us to be even talking about, and love delivering things like that to the audience. So tell us a little bit. I'm going to kind of you probably have a bunch of things going on that a group of senior serving professionals, whether it be research or what have you, that might be of interest to us. And anything else that we need to know about?
Yeah, I want to spend a minute talking about sort of an adjacency to our CareScout businesses. I told you that we really work, we started to work through employers. About a year ago, I challenged my team to figure out how to build a commercial operation out of CareScout. In other words, they served our policyholders and they do an amazing job. As a matter of fact, they are the sort of the gold standard when companies look, just like they look to Genworth for white papers and sort of guidance, they look at CareScout. CareScout does care advocacy work for probably a half a dozen other long-term care providers because they're recognized as this expert. Well, that's great for policyholders. I challenged my team to come up with a way that the general public, we talked about, most people don't own long-term care insurance. So when they get that fateful call, if they don't have a long-term care insurance policy, what are they to do? And so my team conceptualized and then built an employer offering that I referenced around CareScout. So there doesn't need to be an underlying long-term care policy. We, just in the last 90 days, have made about 400 presentations to companies who have put their hand up and said, hey, my employees are struggling with caregiving. What do you have? I heard you've got this new program. And so this program comes, we sell it to employers. And I wanted to tell you folks about it for just a minute, because you may have employers or employees that you're working with of companies who've struggled and said, I wish my company would do something. I just want to sort of give you an overview of this service. And if it works and you can refer business into it because it would help your caregivers that you're working with, that's fantastic. If nothing else, it's just a more general awareness, right? And so this service, we go into a company and we say for a few dollars a month per employee, we're going to cover your entire cohort of employees. We just pitched to a company on 100,000 employees to give you the size and scope of what we do. And we just onboarded a company that has 900 employees. So size is irrelevant to us. And what we do is we go in and we present and run awareness campaigns for employers and say, when your employees, and we run this in employees too, when your employees realize they're a caregiver, either they've been one like myself, or they get that fateful call, all they have to do is make one phone call. They pick up a phone, they call our CareScout team. All calls are answered by licensed nurses or social workers. They don't get a telesales center where somebody doesn't know what they're talking about. It's a licensed clinician who does an intake form and says, Steve, what are you calling for? How can I help? What's going on? And they ask all of the questions that we would all ask. The phones are only manned by experienced people who do this only. They're not doing part-time this and part-time something else. This is their vocation. And then we go to work for that employee, for that caregiver, whether it's providing them general guidance, whether it's they've got to have, I always describe this as a simple question with a really difficult conversation, which is whether they have to have the call with the conversation with their parents about taking the car keys away. It's a simple thing, but an impossible conversation. Most people have no idea how to have that conversation, what to do. And so they can call us and we'll give them out. We'll send them out literally an instruction sheet, if you will, sort of a case study of how to do it. We'll even get on the phone with their loved one and help guide that conversation. It could be something general like that. Or I'm going to bring Lewis back into it. It's, hey, I need some modifications to my house. I don't even know where to begin. Can you help me? And so we really run the full gamut, and it's very inexpensive. We offer it on an annual contract. And so this is the newest business that we've got. It has been incredibly powerful to go to companies and the relief that we get from caregivers when we tell them about this. You can literally see that sort of stress melt off of them, right? And they're like, oh my God, I got somebody who understands what I'm talking about. So that's really the latest service that we've got.
Yeah. And I think it's the benefit to us and those that can get on the CareScout list is the more people, the more companies you sign up, the more exposure you're giving to your trusted providers. And
absolutely,
we see so many varying degrees of support that employee assistance programs can provide in this area that it sounds like that's a great strategy for you guys. I was glancing at your website out of the corner of my eye, and I saw that on your Aging and You resources that there's a box on simulations, and that I think I remember reading about this. You guys invested in sort of a suit that you could put on that sort of simulated some of the typical sort of aging experiences. How that you did that a few years ago, right? Or is that a recent?
We did. It was an aging simulator, and we actually did a series of road shows where we would take this mechanical suit and we'd bring it around, and it was amazing to watch. I wasn't here, but I've seen the videos, and to watch people do it was really incredible. That's it. That's right. Yeah. So, but what's fascinating is we said, well, we can't keep doing a road show. We can't keep moving this suit around. What we have done, though, now is you can actually go on our website where you are, and if you go underneath the Aging and You and go down, keep going. Where I'm trying to see where you are. Well, I don't want to.
Okay.
There are 3 simulators that people can do online.
You've got a hearing impairment,
Yes, there's a hearing one.
Vision.
Yes, it is super cool. So consumers can go on there, and it's funny because we see, right, we can watch how people flow through. They can simulate macular degeneration, right, and cataracts. So you can actually see on a sliding scale. You've got it up you have the mobility one up,
Mm-hmm.
right, and the vision one is on the right hand side, and you can slide that scale around, and you can watch cataracts, normal vision, narrow all the way down. You can do the same thing on mobility. So you can simulate what Parkinson's like implications are. So you try and move things from one shelf to another, and you slide the scale, and you literally can see how hard it is to control your motor skills. It's amazing, and it's sort of a tip of the hat to our aging experience, where it was awesome, but we wanted to provide even more of that. And there's more of these things coming as we build even a more robust site around simulations.
Yeah, I'll check those out, guys. I put the link to that site down, and I'd be curious, as we're all aging, quote unquote, aging experts, your impression of that. As somebody who's had a cataract and cataract surgery, I'm really eager to try that out. You know, and I like how you labeled these empathy labs. And I think that's what's really important about some of these tools, is whether it be the virtual dementia tour or the VR, some of the VR things, it's creating platforms that can give us more empathy when we're communicating with our loved ones, with our clients, to just understand what somebody might be going through. I think one of the things, and you probably encountered it with the robot, and sometimes I hear this when people talk about their virtual dementia tour experience, you're sort of, and why I like these little do-it-yourself kind of focus on one thing, the chances of somebody having, severe cataracts, voices in their head, arthritic hands and feet, and, memory impairment, having all those conditions all at once is minimal. It's usually we have one or two, or it's a growing process. And I think sometimes, like something like the virtual dementia tour, where we're giving people the experience of everything together, it can really have sort of an ageist effect, in that, oh man, I don't want to grow old and all that stuff is going to happen to me, when it might not happen to you. And more than likely you're going to have cataracts, and then you're going to have something else, and it's going to hit you slowly at one time. So that's awesome.
Yeah, well, thank you. And we're continuing to refine. The question comes up, and when you were looking at the website, you saw somebody who had the goggles on, right? The virtual reality goggles. And we had done some work on those. Now they're looking at continuous, how do we use artificial enhanced virtual reality to simulate even more, right? And how do we lift that from people needing glasses? How do we bring that into the web experience so that more consumers can get a sense of what it is? So as an example, it's great to show the Parkinson's one, and it's very interactive, but it's a singular flat view of moving things from A to B. It doesn't reference or show you moving from a room to a room, right? And so we're trying to enhance the empathy labs and the way we present some of those challenges, so that both consumers, their family caregivers, and those that are in the business can really have a finer appreciation and understanding for just the difficulties of aging and coming down to your point. It would be like, the worst lottery win ever to get all of those things at the same time. But it's not uncommon for people to roll from one to the other, right? Mm-hmm. And so we want to make certainly consumers aware. We want to make caregivers even more empathetic when we can. And we'll continue to develop those types of resources.
Awesome. No, this is great. Great. You've been turning us on to some great resources that I wasn't aware of, and I've been on your site a few times. And doesn't that drive you crazy? I've got the same problem with my business. It's sort of like, gosh, if only there was a place that had this. And it's like, gosh, I've been doing that for 30 years. Okay. What am I doing wrong? But that's why we do programs like this. Guys,
100%.
we're getting close to wrapping up. And so I always like to do sort of the last call for questions, comments, topics, and whether it's related to Larry or not, just this is a great format. Larry, anything sort of as we kind of wind down, and any other resources that you'd like us to know about, or any things that you've got on your horizon that you're thinking about?
I do. So and thank you for asking me, because there's just one more, although this is, it's probably really germane to this audience. If we were all consumers and caregivers, I probably wouldn't mention it at all. But because we're all in the business, I would let you know that we are in the middle, or the beginning really, of standing up an entirely new business around caregiving. And this business is really going to be what I would describe as sort of an all-encompassing caregiving, care receiving, intergenerational play, right? We know that most caregivers happen to be people with gray hair like me, and certainly older. 50% of caregivers are taking care of their spouses, so they're aging into their 60s and 70s and potentially older. But there are 25% of the caregivers are millennials, by the way, just right. So that puts 10, 12, 15 million of these caregivers are millennials. We're building a business that looks at how do we provide intergenerational support, right? How do we take that younger caregiver and help them teach their children about the art of saving for old age and older life? How do we take the person who's my age, who's providing care for their parents? How do we help provide me with my own personal needs while I'm attending to my parents' needs, and help me teach my kids how to prepare better than maybe I did or my parents did? And we're in the beginning stages of this, but as we develop it, our goal is to build out the same type of referral network that we've done for CareScout, but on a much broader spectrum, where CareScout is really aimed at caregivers. This one is going to be much broader. So if you're a provider that is interested in finding out more, there's nothing to really do now, but just know that we're in the beginning stages of developing an idea. I am unbelievably excited for it because it'll be new. It's a new category the market hasn't seen yet. And stay tuned. We've got a whole team that's working really diligently on it.
Oh, I love it. And when you talk about empathy and breaking sort of stigmas related to growing older, introducing younger generations to the challenges, solutions, and elders it never fails. But unfortunately, it's not easy to do. We've got this generational wall. Casey Ryerson has their hand raised. Casey, did you have a question?
I did. And the first question is, as part as the caregiver model that you're working on, Larry, I am a studying doctoral student, and I'm writing my dissertation on employee turnover. So I'm very interested in connecting with you. And the second question is about adding your single moms or single dads that are in the sandwich generation. So you may have a single mom that's taking care of their adult parent, and they're also trying to take care of their child. And it's even worse in this virtual schooling.
Oh my gosh, you are so on the money. If you go, Casey, first of all, thank you for the question. I'd love to connect and talk more about what you're doing. If you go to our cost of care survey, one of the things we zero in on is the changing family dynamics, right? We look at what I'm going to call traditional family, only because that's what the survey refers to it as, right? Where it's two spouses and children as a support mechanism or a network. And you can see over the last 40 to 50 years, the decline in what that traditional family looks like. At the same time, the opposite effect of single parent families and what they call non-traditional, which is a single parent who maybe has taken in a boarder, right? Or has taken in somebody to rent a room or has a non-family member living with them. And the increase in that, we tell that story around the caregiver because it's more pressure, to your point, on that caregiver who doesn't have the same support network. Now factor COVID on top of it, and it's off the charts, the pressure they're under. You couldn't be more spot on that.
Thank you.
Yeah, thanks a lot, Casey. And Larry, I hope you didn't mind. I just threw your email address into
absolutely
into chat, and I just added the link to the cost of care trends. And I'll send all this out in the follow-up email to everybody. I haven't been on the site in a while, and man, guys, you look at some of the charting that they've done because they've been tracking, like, for example, nursing home costs over, the last 17 years. They've got some great data that we can all use. Okay. So, well, this is awesome. We are, I think, basically, let's see, Beverly Jacoby has got her hand raised. Beverly, did you have a question? It could be a mistake. Sometimes people, Beverly, are you on? You have a question? Okay. Well, Larry, unless Beverly jumps on here, we are going to wrap things up. And I really thank you for your time today and introducing us to some great research and some great products. Guys, I will send out a recording. I'll send out the chat transcript. I'll send out some of the links that we referred to in Larry's email. And we look forward to seeing you guys next week. And you're going to get to meet more women in elder world, women leaders in elder world at each of our sessions. You'll get to meet one of them in a little more detail. So Larry, thanks. Anything you want to add in closing?
I would only say thank you. First of all, thank you for having me. And it was a pleasure. I look forward to connecting to those that want to connect. More importantly, thank you for all the work you guys are doing. As a caregiver, I will tell you the support we need more professionals, not less, right? There is going to be a great need for more support as the people continue to age. And thank you for the work that you're doing in the support of caregivers. It's greatly appreciated. And I look forward again to connecting and perhaps joining you guys again down the road. Thank you so much and have a great rest of the day. Take care.
All right.
Bye-bye.
Okay. Talk to you.